Well, for more on National Cabinet's agreement of a four-phase plan, I'm now joined by Liberal MP Andrew Wallace and Labor MP Libby Coker. Thank you for joining me. Let's get straight into it. Libby, we'll start with you. What do you make of this four-phase plan out of the pandemic?
Look, this four-phase plan is okay in theory, but the fact is, if we don't have a vaccine rollout that's effective, the whole plan makes no sense. What we need is a government that is prepared to roll out a plan for a vaccine. And at the moment, we've got 8% of Australians vaccinated, fully vaccinated. And it is a very sad outcome for the people of Australia. So we've got 12 million people in lockdown at the moment. It is not a plan that will work unless we have the vaccine rollout under control. And at this stage, we don't.
But Libby, we've been talking about vaccine incentives for some time, for example. Does this not give Australians some sort of a way out of the pandemic if they are vaccinated?
Look, being vaccinated is so important, but there's been so much confusion. I've had a number of constituents, many of them ringing my office and asking me, what do we do? Now, I know for many young people, we want them to be vaccinated and we do encourage people to go and see their GP. But at the moment, 8%, we are underdone. We are really at the back of the pack in terms of the OECD countries. We need more people vaccinated, and then maybe we can move on to stage 2, 3 and 4. But at this point, I would really urge the Prime Minister to run a campaign, an awareness campaign. So what we get is a community that are comfortable with being vaccinated, that there isn't the confusion, and we get far more people going out and getting vaccinated right now.
Andrew, we still don't have a threshold, that magic number that the Australian population is wanting to see to know when we can move forward, to know when we can go to that next step. When do you think we can get some sort of an indication as to how many people need to be vaccinated before we can see some sort of normality?
Well, it's a billion-dollar question, Danica, and I don't think anybody knows the answer to that right now. I mean, the government is working on modelling to try and determine what that magical figure is. But look, there's a couple of things that Libby has touched on that I just have to respond to. The government launched its information campaign on the 27th of January of this year. It's spending some $31 million on that information campaign. I don't know what she watches or what she listens to if she thinks that there's no campaign, because certainly it's being rolled out across the commercial television, ABC, and also broadly on the internet as well. So the government does have a communications program out there. It was very good to see the Prime Minister out on the front foot this morning talking about this four-stage plan. It will no doubt lead to, this is our path out of here. Everybody wants to receive or go back to some form of normalcy. Everybody wants to see an end to this. But there's no rule book on how to go about this. And I think it's important just to recognise that for all those armchair critics out there, particularly those in the Labor Party, if you look at the deaths per 1 million head of population in comparable countries like the United States, 1,864. In the UK, 1,878. Now, this is per 1 million head of population. In Australia, it's just 35. We represent about 1.8% of the deaths in comparable countries like the UK and the US. So, Labor can try and throw as many stones from armchairs as they like. And it's so sad to see that they're politicising this and continuing to politicise it.
Well, Andrew, there's no doubt that we've been very lucky here in Australia, given that we are an island amongst ourselves. But
it's not just luck.
The vaccine rollout, to be fair, has been incredibly slow up until, now, when that threshold has changed for AstraZeneca. We've had about 8 million doses this week. Are young people key now to saving the government's vaccine rollout?
Well, I don't think it's just young people. There's 25 million people in this country. And I think it's important to recognise that the first 1 million vaccines took some 45 days to deliver. We're now down to 8 days to deliver the last 1 million. So we're at 8 million people that have been vaccinated now or have received their first vaccination. And I think it's important to also recognise that because there's a 12-week window between the first vaccine and the second vaccine in relation to AstraZeneca, because we were very careful, we didn't rush into delivering these vaccines. The TGA was very methodical in the way that they did their research on these products. Yes, we are around about 4 months behind the rest of the world, but equally, if we had been putting shots into people's arms that didn't go through those processes, and we did see unfortunate circumstances of people dying, then everybody would be jumping up and down and saying we jumped into this too quickly. So we erred on the side of caution, as we should have done. And what we're seeing now is that lag, but equally what we're seeing is a dramatic increase. And I've been saying this every week, Danica.
Yeah.
Every week I've been saying this in your program.
Yeah, well, hopefully, fingers crossed now we do have some sort of leeway out of this pandemic. Libby, we've also seen today this 50% reduction of international arrivals. Gladys Berejiklian made an interesting point earlier. She said that she doesn't support the Premier's decision to reduce this. It is based on how we react to outbreaks. Do you agree with what she's saying?
Well, I think the 50% reduction in the number of international visitors is important. It will help reduce the spread of the Delta virus. But we still we've got 30,000 people overseas that I'd still like to see come home. I'm not a health expert. In terms of what the Queensland Premier has said, I think I'll leave that to her. I would actually like to respond to a couple of comments that Andrew made. One of them, if we've had such a clear awareness campaign, I really don't understand why we've got so many people so confused about whether they should get the vaccine and why we have such a slow take-up. So I really do dispute the fact that we've had an effective awareness campaign. I also think that the idea that we've taken this slow and carefully is a concern. We do need to go carefully, but this is a race. We cannot be complacent. The virus is virulent. We need to actually move very swiftly. The fact that we had 84% of people in aged care who were infected by workers who were not vaccinated is very concerning. And we need to make sure that what this was in the past, in our previous lockdowns, we need to make sure now that we vaccinate workers who work with vulnerable people. We need to get out there. We do that as quickly as we can.
All right.
And we need a very good, effective campaign.
Andrew, just to throw to you on that point, the federal government has been saying for a long time that this is not a race, but we're now last in the OECD nations for our vaccine rollout. How can we continue to say that it's not a race?
Well, I think we need to differentiate this. As I said earlier, just a few moments ago, if we had rushed into delivering vaccines into people's arms that hadn't gone through the appropriate TGA processes, we would have been rightly criticised if things had have gone wrong. Now, we took a very methodical approach to this. We asked the TGA to be very careful about it. The TGA, whilst they expedited their processes, they went through the full process. I was just reading the Pfizer website in the US this morning, and the Food and Drug Administration for Pfizer still have got a preliminary approval. In Australia, it's finally approved, but the TGA haven't finally approved it yet. We took an approach where we did a full and thorough assessment of all vaccines to be delivered into people's arms, as was right to do that. Now, as a result of that, we are seeing a longer process in us being able to say, yes, we've got X number of percentage of people being vaccinated. But that point that you're drawing about the low take-up is for full vaccinations. What I said earlier about that 12-week lag, once we are now starting to vaccinate people for their second doses, and we will see those second doses significantly increase in the very foreseeable future. And we'll be increasing that number very, very shortly.
All right, well, fingers crossed we do get there. Andrew Wallace and Libby Coker.
We'll get there, Jamaica.
Well, we'll get there, he says. All right, thank you to both of you for joining me this afternoon.
It might take some time. We need to move faster.
Well, you keep talking the country down, Libby. You keep talking
We're not talking it down. We're
That's
being
exactly what
constructive.
you're doing, Libby.
We've always provided constructive
you guys
advice.
wouldn't know what constructive was.
All right. Well, we'd love to continue this debate, but unfortunately, time is our enemy right now. We've got to go. Thanks to both of you. We'll see you again soon.